Only on 2 tonight, a Houston hospital is having success treating the coronavirus patients. In fact, its recovery rate is perfect.
Fascinating, isn't it? Tonight, Channel 2 senior reporter Phil Archer takes you inside the hospital's COVID-19 ward to meet the doctors, the nurses, and the patients to see what's working.
Caregivers in the COVID ward suit up to battle the virus the same way every day. First, a protective plastic jumper over scrubs. Then, 2 pair of protective booties over that. Then comes head protection, a protective gown, 2 face masks, and safety glasses.
That's better.
Along with a face shield. All of that topped off with a photo to show patients there's a person lurking beneath all of that.
You don't have any problems? You can fit just yes?
It's time to make rounds at the United Memorial Medical Center, a small suburban hospital on the city's north side. Today we're ghosting Dr. Joseph Veron, the hospital's chief of medicine.
So we open up here.
The COVID wing is sealed off from the rest of the hospital. Beyond the plastic curtain, there's a different, more dangerous world. Coronavirus is literally in the air here.
Let's walk back to front.
This is what most of us never see, the pain behind the case numbers. Patients like 57-year-old Faye Edwards.
I feel a little better than I did a week ago.
She's convinced she contracted the virus in a crowded Houston grocery store last week.
Stay home. Stay home. Stay where you're safe, where you're healthy.
And 40-year-old Bianca Gaikan. She's nearly recovered now.
It's scary. It's something that's scary, and I thought I was going to die. And now that I've came this way and got this far, I feel I don't ever want it again.
It can be a devastating disease, capable of destroying a healthy lung in just days.
What you can see on this man is that his entire lower part of his lung is gone.
To treat patients here, Dr. Veron is using an experimental drug protocol. It's a cocktail of vitamins, steroids, and blood thinners. Each patient also is getting hydroxychloroquine, the malaria drug touted by President Trump. The protocol is controversial because there hasn't been time for extensive testing, but Dr. Veron says it works.
We've treated over 40+ patients with this treatment, and we haven't had a single complication.
So far, he says, none of his patients have died.
This is time of war. There is no time to double-blind anything. This is working. And if it's working, I'm going to keep on doing it.
Providing the care that goes with the medicine can take a toll on caregivers. They work 12-hour shifts that often stretch into days. The days sometimes turning into weeks.
We've been here endless night and days, sleeping in here, napping for an hour basically, around the clock to make sure these people are taken care of.
And sometimes the constant life and death struggle just down the hall weighs too heavy.
The 3rd day, I cried with my sister. I was a little overwhelmed. I didn't realize how serious it was till I actually made a decision to come to the unit.
What disturbs caregivers now is that while many states like Texas are opening up again, new infections are not declining.
The number of admissions that we've had just in the last 2 weeks have pretty much doubled.
As a precaution, the hospital has opened a second COVID wing, just in case. And Dr. Veron believes those beds will be needed after seeing social distancing ignored en masse on Galveston Island last weekend. He calls it irresponsible.
The only thing that they are doing is they are prolonging what we're going through. We're going to have a serious healthcare crisis in the months to follow unless people start respecting this request for social distancing.
That prediction is backed up by FEMA projections. According to the New York Times, that predict an 87% increase in the rate of new infections by the end of this month. And we told you that Dr. Veron's treatment protocol has not been fully tested or approved, but he and 4 other doctors across the country who are using it have set up a registry to collect data to determine exactly how effective it is. Phil Archer, KPRC Channel 2 News.
Very